African queens, blatant historical inaccuracies. You're gonna love it. This sketch is going to take place in the African wilderness, one of the three major areas where you may encounter our next parasite, Plasmodium, which causes the mosquito-borne illness malaria. Malaria is characterized by symptoms such as a fever and headache, and patients often have anemia and splenomegaly. To make the diagnosis, you perform a blood smear and use a Giemsa stain. To remind you of these, we have a box of gems with a blood smear, kind of like blood gems or blood diamonds, Leonardo DiCaprio style. While under a microscope, we'll be looking for the parasites inside red blood cells. There are 4 species of Plasmodium that you need to know. In our dangerous African wilderness, these 4 nefarious species will be represented by warlords in search of the blood gems. You better watch your blood gems. Let's introduce our first warlord, Plasmodium malariae. Oh man, you could probably smell him from here. I don't speak much Italian, but that is some malaria. You see what I did there? What's interesting about the different species that cause malaria is that they each have a unique fever pattern. Plasmodium malariae follows a quartan fever cycle, meaning the fever occurs on day 1, then 72 hours later, it occurs on what would be day 4. We'll represent this by drawing these buttons on the front of his tunic. And notice that the first and fourth buttons are colored like the red-hot African sun. Alright, our next African warlord is going to represent Plasmodium vivax and Plasmodium ovale. For the boards, you can treat these 2 species as if they were the same one, and we represent them with just one warlord with an oval shield and an axe, ovale and vivax. He's using hypnosis and swinging his pendulum to remind you that vivax and ovale produce dormant forms in the liver called hypnozoites. So these species hide out in the liver, which we'll represent by the cowhide with a liver spot on his shield. What's interesting about these species is that they follow a tertian fever cycle, where there is a fever on the first day, then 48 hours later, i.e., the 3rd day. We'll represent this by coloring in every other circle of the hypnotizing pendulum swing. Now, stare deeply into the colored circles.
It's okay, relax. When I say the word merchandise, you're going to buy 5 sets of sketchy micro tube socks.
Just kidding. You'll probably only need 1 set. You know, for that special friend who has everything. Our next warlord is going to represent Plasmodium falciparum. This is the species that causes the most severe malarial illness. So the P. falciparum warlord will be wearing a false mask. And yeah, he's pretty scary. In contrast to P. vivax and ovale, his fever patterns are irregular, like the irregular ups and downs of the bottom of his torn shirt. Also, patients may present with neurologic symptoms as parasitized red blood cells occlude the capillaries in the brain, which we'll represent with this red headdress for cerebral malaria. They can also occlude the vessels leading to the kidneys and lungs, so we've added in a gold belt around his waist, and lungs are symbolized by the gold chest plate. You may have noticed that the headdress looks like a bunch of blood-red bananas. It's not because he has a poor sense of style, it's because he has a superb sense of style, some kind of nightmarish mix between Jason and the Chiquita lady. And we want you to remember that P. falciparum is banana-shaped in the peripheral blood smear. So these attackers only have one thing on their minds: to steal your gems, your money, and suck you dry just like a thirsty mosquito in a room full of patients with polycythemia vera. But we've got some strong defenses to squash them like the bugs they are. Many of the anti-malarial drugs end in quin, and we'll make use of this to symbolize some of the drugs with different African queens. Starting off with color queen, she's our symbol for the drug chloroquine. And there's a reason why she's wearing these colorful beads. Think of the beads joined together as a polymer, and you'll remember that chloroquine works by blocking Plasmodium heme polymerase. Now, remember I mentioned that Vivax and Ovali have a dormant form hiding in the liver. So you gotta call in some backup. Chloroquine isn't much help when she's hypnotized. That's where our primal queen, which is our symbol for the drug primaquine, comes in. She is one fierce lady, and she's clad in animal skins, and she'll destroy those hypnozoites hiding out in the liver. Not only that, if you don't check for G6PD deficiency in your patient before giving this drug, you can cause severe anemia, so be careful. We'll also mention here that chloroquine-sensitive species are pretty rare because of anti-malarial resistance. In fact, the only chloroquine-sensitive areas are in the Caribbean, Central America west of the Panama Canal, and some countries in the Middle East. So, instead, you may want to rely on something like mefloquine, represented here by me fly queen, or me flock queen. Well, the queen wearing an absurd amount of feathers. And we're going to draw her in a palanquin. A palanquin is one of those royal person carriers that your servants get to carry you around in. And whenever we draw a queen inside a palanquin, it just means that they're extra strong and they're good against resistant species. So mefloquine is one of these stronger drugs, and she's sitting in her palanquin and is better able to ward off the attackers. Also, mefloquine is a great choice as a prophylactic medication that travelers can take to prevent getting malaria. We'll cover the top of her palanquin with luggage, including one of our traveler's backpacks, to remind you that mefloquine should be used for travelers in the chloroquine-resistant countries. This brings us to a drug you may recognize from before. Let me show you the symbol and see if you remember. Eerily familiar, right? It's atovaquone. And actually, a combination of atovaquone and proguanil is a great antimalarial prophylactic or treatment drug. For those of you who didn't watch the babesiosis video, this is the Vampire Queen, who just happened to be in the area visiting her African queen friends. She is sitting inside her palanquin, so she's better at warding off the attackers that got by the color queen. And she also brought a gift from her world travels. Why, if it isn't an iguana? To remind us, of course, of proguanil. Let's also add luggage on top of her palanquin with the traveler's backpack to remind you that atovaquone proguanil can be used for travelers in the chloroquine-resistant countries. So the queens seem to be doing a good job of warding off the attackers representing P. malariae, P. vivax, and P. ovale, but what about the scary-looking P. falciparum false mask guy? In order to treat severe infections, usually caused by P. falciparum, you can use drugs that are called artemisinins. These go by the name of artesunate or artemether, depending on the formula and dosing. It's more important that if you see a word that looks like arta, it should be something you associate with Plasmodium falciparum. For that reason, we're drawing in an artist here, and she's defending her queen. You can also treat some of these infections with atovaquone proguanil, so let's make this artist painting a portrait of the Vampire Queen. Lastly, we'll give the artist a threatening sickle to ward off the attacker. This represents that sickle cell disease is protective against Plasmodium falciparum malaria. The patients suffering from severe malaria infections, who could be suffering organ damage and in the intensive care unit, are going to need some serious backup. But until the situation becomes more life-threatening, we'll let the backup just relax for now. Let's introduce IV artesunate, which will be represented here as another portrait artist. She's not too worried for now, and is facing away from the action, nonchalantly painting a portrait. Another drug is quinine, or quinidine, which is represented here by this blasé queen dining. She'll lounge here in the back until the situation becomes more dire. She sits in her palanquin stronghold and can be used against resistant species. Do you remember from pharmacology what some of the side effects of this drug are? Right, synchonism, which consists of headaches and tinnitus. This is why we added the tin cans to her feast. Also notice there's some ivy wrapped around her arm and the arm of the artist to represent IV delivery of these drugs. To wrap up this video, we'll briefly review the life cycle of Plasmodium. To help us, I'll call in this lovely cow with a liver spot. Let's get started. Malaria is transmitted by the Anopheles mosquito, which carry the sporozoites in their saliva. We'll draw in this red, bloody-looking mushroom. You should relate the mushroom to spores, and that should help you remember the word sporozoites. So the mosquito is on the mushroom picking up some spores, or sporozoites, and flying over to the cow. Once the mosquito bites a human host, the sporozoites travel to the liver where they mature to trophozoites. This is followed by schizonts, leading to the rupture of the hepatocyte and the release of merozoites. The merozoites go on to infect red blood cells. Let's draw in a little burst of merozoites next to our liver spot, going toward this little round red blood cell spot. Once inside the red blood cell, the life cycle once again continues to a trophozoite form, followed by a schizont and a ruptured red blood cell, releasing merozoites that go on to infect more red blood cells. That cycle is shown in these two other red blood cell shaped spots. Notice how the immature schizont has a ring form in the red blood cell. This will be represented by the ring shape in the spot on the right. After the merozoite infects the red blood cell, it can also form gametocytes, which are the sexual form of Plasmodium. Let's draw in one more infected red blood cell, represented by this red blood cell shaped spot here on the cow, but this one is next to two brand markings seared into the cow's hide of a male and female symbol. The cycle is continued when a mosquito bites an infected patient and takes up the red blood cells that contain the gametocytes. And that's about it for malaria. After watching this video, you'll now be able to defend against any malaria question that comes up and come out victorious.